Welcome, 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 welcome to the Modern Medicine Movement podcast. Super pumped, guys. Super grateful that you're here with us. I got a very special guest here to my right, the lovely Phyllis Anderson, who's going to be sharing with us her story and helping to raise awareness for a issue that many of us may have never heard of. At least I know many doctors out there haven't heard of this. This doctor right here has, and we're going to make sure that we can really get the word out, because it's something that probably, gosh, I don't know the figures, but I would say many thousands of people out there, ladies, are experiencing symptoms that may be related to this. They have no idea what it is. So we're going to get into that in just a minute, but I just want to thank you guys for taking the time out of your busy days to share with us a little bit of time as we talk about this issue, which is breast implant illness. And this is something that, like I mentioned, a lot of physicians have not even heard of. In fact, unfortunately, it does not even have a diagnostic code. In other words, in medicine, when we give somebody a diagnosis like hypertension or diabetes or whatever it is, there's a code or a label, so to speak, that is used called an ICD code. And I think they're on ICD-10 nowadays. I lose track. Every couple of years, they come up with a new one. And so far, breast implant illness is not part of this yet, but it needs to be. And I think part of us getting the word out there and you guys sharing this and will really help, because this is something that's super important. And if you may have it and you can get it treated, it could literally be life-changing. So without further ado, we're going to get into it with Miss Phyllis Anderson. We're going to have her share her story a little bit, kind of what was going on with her and how she came up with, I think literally she came up with this herself. Her doctor, I think, went along with her, but I'll let her tell the story. Tell us, Phyllis, how this kind of all went down with you.
Gosh, thanks, Thomas, for having me here today, because I really have just had such a nice outpouring, actually an incredible outpouring of interest from women who've just messaged me privately on my social media platforms or called me or texted me, because I've been so just forward with my story. And so anyway, my story began last October when I was getting ready to have just a routine procedure on a toe, little surgery. So I had pre-op labs done, and I went into my doctor and I said, hey, while I'm here, let's just go ahead and do some physical labs, let's get cholesterol and all these things. And so I had all the stuff added on, and lo and behold, my cholesterol came back a little bit high. So the doctor had said, your family has a history of cardiac disease. So I think we really should put you on anti-cholesterol lowering agent drug, a
statin. Don't do it. Don't do it.
Way. I said, that's not happening. And they said, well, you really should be on one. And I said, no, what else can we do? How else can we tell if this is something I should do? So they said, you know what, let's get a cardiac score. I said, okay, great. I don't even know what that was, but I was like, let's do it. So $150 later, I had to pay for it out of my pocket. No big deal. It was a CAT scan of my chest, and it was looking for calcifications of the large, coronary vessels to see if I had some disease there. Well, I went in for my test. No big deal. 2 weeks later, I got a letter in the mail from the radiology department that said, congratulations, your cardiac score is 0. Incidental
That's
finding.
The best possible score ever, by the way, guys. 0 is like nothing, no calcium in her coronary arteries. In other words, clean slate from a cardiac perspective. Miss Phyllis Anderson gets amazing blood flow to her heart. That is not the issue.
That was not the issue. But the issue was this incidental finding, as I kept reading down this piece of paper that was delivered by snail mail that said, your right breast implant has ruptured. Now, listen, I had 0 pain, 0 deformity, no lumps, no bumps, nothing. I had no idea this was happening inside my chest.
No, in other words, no physical findings that she or her doctor were able to tell from, like she said, the size, shape, contour of her breast. She didn't feel any lumps. Yet she had evidence on the CT scan that was done for a completely different reason, that her right side breast implant had ruptured. And this kind of light bulb went off, and tell us how all these things came together.
Well, what's interesting is in August, I'd had a mammogram, and I'm like, that's weird. My mammogram didn't talk about a rupture. And let's see, the mammogram. Anyway, I just thought that's really strange. And so, but right away, I said that thing has to come out, because I'm a registered nurse. I work in the emergency room for over 22 years and have a little bit of medical knowledge in my head for sure. And I just knew this thing's toxic. It's got to come out. So I called my surgeon who had put the implants in 12 years prior. And I told the office, I said, I need to get a consultation, but I'd also like to schedule my surgery today too. So not only did I make my appointment to see my doctor, but I scheduled the surgery. And then I started to look into like breast implant rupture, and then breast implant illness came up, and all these different diagnoses, like, or symptoms that women had been complaining of, or reporting, I should say, not complaining of, just reporting. And so another test that my doctor had added on was a rheumatoid arthritis factor, because my family has history of that. And I was telling them about my hands, and I had some random just flaring joint pain that was just weird for me. My body just hurt. And I was a marathon runner, cross trainer, like super fit, very healthy, ate well. And so that didn't make sense, other than my dad has a history of rheumatoid arthritis. So I thought, okay, well, let's just look at that. So that factor was positive. The rheumatoid arthritis factor was positive. So I also made an appointment with a rheumatologist that I couldn't get in to see until the very end of December. So I had some more blood work done, and this showed not only was my RA factor positive, but my CCP, which were antibodies, was very, very, very high. So my rheumatologist wanted to put me on some medications, and I said, you know what, we're going to hold off just for a second, because I'm getting these implants out in a week, and I really want to see the difference.
And what's interesting, Phyllis didn't totally back up all the way, maybe she will, but we were focusing on, getting the implants removed. But what's interesting is when she was doing the reading on her own and looking into the whole issue of breast implant illness, she became aware of, all of these symptoms, all of these things that were being experienced by many women who had this condition prior to her, that described, all these different, which could often be misconstrued as rheumatologic symptoms, like she was mentioning rheumatoid arthritis, or, there's all these other rheumatologic illnesses that cause joint pain, joint inflammation, and these types of things. And she had noticed in herself that she had some of these symptoms. And when her physician did the tests, big surprise, her levels of inflammation, like CRP, for example, the rheumatoid factor, these were all through the roof. And if you're a rheumatologist and you see this, it's sort of that old dictum, right, Phyllis, where if all you have is a hammer, everything starts to look like a nail. And so they see elevations of the rheumatoid factor and elevations of the CRP and other inflammatory markers. And they want to go, oh my gosh, you have rheumatoid arthritis, Phyllis. At 50 years old, you have rheumatoid arthritis. And I remember a conversation that Phyllis and I had several months ago, and she was kind of telling me these things. I said, Phyllis, you do not have rheumatoid arthritis. I mean, call me crazy, but as a physician myself for 20 plus years, you just don't see rheumatoid arthritis de novo, or starting out of nothing at 50 years old. That just doesn't happen. At least that would be rare. And Phyllis, you are not this rare zebra out there. You are an awesome, normal woman, and you do not have rheumatoid arthritis. Don't you remember? I told you that.
Yeah.
And so she, being the smart lady that she is, she kept doing her research, and she's like, no, I have breast implant illness. That's what I have. I've been studying it, and it all kind of fit together. But, that wasn't anything that came out of any of our physicians' mouths. Am I right?
No, I've never. And no. In fact, my plastic surgeon, he was so amazing. He said, I believe in it. He said, but even some of the top surgeons, and I'm here I'm in California is where I live. And he said, with COVID, we're having to do our conferences and conventions all via Zoom. And he said, they're seeing out all these people, and these top surgeons roll their eyes right now and say that these women are crazy and they need to be put on anti-anxiety medications, because they're having panic attacks. They're like, we'll go through a list of the symptoms, because I really feel like it's so important that you listen because some people say, oh, I'm not having any of those things. I don't have rheumatoid arthritis. Nobody told me I have an autoimmune condition. It's so much more than just that, you guys. So just really excited to be able to bring awareness to it.
Yeah, that's why we're speaking of that, Phyllis. Let's show them some of the possible symptoms that we were talking about. And I'll pull up, for those of you that are watching this on YouTube, there'll be a screen share so you can see actually a pretty informational website that I think you guys will appreciate checking out. If you or anybody you know might have some of these symptoms and have in the past had at some point some type of a breast implant. And it doesn't matter, we'll talk about this a little bit later, but it doesn't matter the type. There used to be this kind of thing where it was just a silicone implant and that's the only thing that could cause this. Well, guess what? Even the saline implants, the bag that holds the saline, if you will, the reservoir, that is made of silicone. So all breast implants can potentially cause this breast implant illness. You're not out of the woods, as they say, if you have a saline implant versus a silicone implant. And so any breast implant can cause this condition, and hence the name breast implant illness, right? It's not called silicone breast implant illness. It's called breast implant illness. So Phyllis, what's the name of that website? And we'll throw it up here for the viewers here.
breastimplantillness.com.
Okay, so I'm going to pull that up here and let's see if you guys can see that. Hopefully it works.
Yeah, there it is.
breastimplantillness.com. So what's interesting, and you guys will be able to see this, those watching on YouTube, is that the list of symptoms is pretty lengthy, and you do not have to have all of these symptoms. You could have just a couple of them. But when I read some of these out, Phyllis, if you're watching on YouTube, you'll see she'll be nodding because she had a lot of these symptoms. Here's the list: fatigue, chronic fatigue, some cognitive dysfunction like a brain fog. You're just not thinking as clearly. You might think you're having a senior moment, but you don't get those at 50. Come on, we're all young people around here.
Yeah, I had some serious brain fog, and it was like word finding, and I just felt slow, and it was coming on rapidly. And I guess I didn't say that with that surgery. I had this little toe surgery in October. It's like it threw my body into this massive inflammatory state, and it just felt like my body, I literally felt like I was dying, and I'm not being dramatic at all.
Phyllis is not dramatic. She's not like that. I've known her for a few years.
I just was like, something's really wrong here. And so it was almost wonderful to find out that I had a rupture, because there was my answer. I just knew it. So
she knew it, and thankfully she had a physician that listened to her, because as a physician myself for 20 years and working with lots of patients and lots of other physicians, I know sort of a knee-jerk reaction for a lot of physicians. Once anybody comes out with more than one complaint or one symptom at a time, they do the eye roll sometimes, right, Phyllis?
Right. You're crazy.
It's not possible. You can't have 10 different symptoms at one time. It must be in your head. You must be making it up, and this is not the case. Let's look at a couple of these. So she was talking about the cognitive symptoms of the brain fog, the concentration, the word finding, muscle aches and pains and weakness, joint pains. Phyllis talked about that. She was having swelling of her hands and feet, and it just, which was unusual, it kind of came up fairly all of a sudden. Is that right? It wasn't.
Yeah, I couldn't wear my wedding ring. And so look what's on my hand. If you can see us on YouTube, my wedding ring fit me 6 days post-op, you guys, after explant. That's crazy. Like huge, I lost difference. 8 pounds within the first week. I had, there's more symptoms, but I had the dry eyes, the weight gain. I was gaining weight and could not figure that out, but it was just inflammation.
And that weight loss she talked about, which was pretty much immediate within a few days of the surgery, a lot of that's just inflammation. Inflammation will cause weight gain. I mean, inflammation is not normal, not natural, is not what your body wants. And so a couple of the other things she just mentioned, that the dry eyes, dry skin, dry mouth, this often is misdiagnosed as something called Sjogren's, which is another condition. It's a immunologic kind of autoimmune type condition that also happens to occur in young, otherwise healthy ladies like Phyllis. But she knew that this wasn't the issue. Maybe the rheumatologist might have thought otherwise, but she knew that it was something else that was going on. And I felt similarly. And I told her, you don't have a rheumatologic condition. This just doesn't happen out of nowhere. There must be something else going on. Easy bruising, bleeding, temperature. Did you have any of that temperature intolerance? Too hot, too cold?
Well, hot flashes.
Hot flashes. Okay.
Women talk about that.
Some other symptoms: low libido, ringing in the ears, heart palpitations, shortness of breath. This is something that I want Phyllis to describe what she felt and how dramatic her recovery was. Tell us a little bit more about the shortness of breath that you had.
Yeah, so I had actually seen an ENT, and I had a sleep study. I had a CT of my sinuses. I had a scope down my nose because I was snoring at nighttime.
She got the work. She got
my
the
husband
full
was like,
workup.
"You're really snoring." And so I thought, you know what? If I have sleep apnea, I need to get that fixed because there's a lot of really bad things that can happen as a result of sleep apnea. So I was like, I might as well uncover every stone. Well, the ENT told me, well, you actually have a long palate and your sinuses need a like roto-rooter and this palate needs to be cut. And it's a 2 week like recovery surgery where you can't eat and you're going to lose weight and you're really not going to like me for 2 weeks.
But if you're a surgeon, right, that's what you're going to offer your patients. You're going to offer them surgery. And once again, I had a discussion with Phyllis over the phone, and she was also telling me all this stuff. And I said, Phyllis, number one, you are not the normal, body habitus of somebody that would have sleep apnea. And no offense to anybody who may have this, but the common, body habitus is somebody that's, got a real thick neck. They're a little bit overweight. They have just kind of what we would call redundant tissue. And that's something that, the ENT doc will say, hey, well, I can remove that extra tissue in there. And what was happening with Phyllis was not that she was overweight, because she certainly is not and was not. She was not having redundant tissue, but she was having inflammation. And in the back of her nose and mouth, you have, immune system tissue, lymph tissue, like the adenoids, tonsils, and those sorts of things, which in her case were all swollen, were all contributing to her snoring, her difficulty breathing, these symptoms. And tell us about what happened after you had your explant. How did that go down?
So I remember driving home. We had an hour to drive home after surgery. And I said to my husband, I said, I can breathe through my nose. Like it was like everything had just opened up. I could breathe. And the next day,
which is weird, guys, because usually after you have a surgery, people are complaining of the opposite, because you've usually had like maybe an ET tube placed down your back of your mouth and your throat, and you have actually some irritation and your breathing might be worse after surgery. In her case, her inflammation was already improving and she was actually breathing better.
Yeah. And I'm not the only one to say this. This is super common. And the next day I saw my doctor. I said, I can breathe. Look at this. Because I could just breathe through my nose and, show somebody that you could tell that my sinuses were plugged or more congested. And so he just nodded his head. He was like, I know this is, he just was like, yep, this is amazing. And he's just the biggest fan, and he's just excited to hear that we're feeling better after explant and capsulectomy. And
all of a sudden, right, no need for big giant ENT surgery, which was awesome.
Can you believe
but what the sad thing is, not all folks will recognize and put these things together. And some may go about and have these kinds of unnecessary surgeries because they don't know. So that's why we're doing this today. That's why Phyllis is here to share her story, because it's so important to get the word out, because millions of these procedures are happening every year. And there is a significant number of ladies that will get this illness. And if they don't know about it and their doctor doesn't know about it, imagine what may have happened. Phyllis may have had a big ENT surgery, and guess what? That would not have definitively corrected her issue. She would have still had symptoms, right? Yep. And we're glad that it didn't go that way.
No.
Oh, here we go, Phyllis, the night sweats. It's on the list. You mentioned that. Night sweats, it's on the list. Skin rashes, insomnia, difficulty sleeping, hormonal imbalances, early menopause.
I was 41 when I stopped having periods. I have had breast implants for 18 years. And so at 41, I stopped having periods. So for it to interfere with your hormones is really scary, guys.
And it's a real deal. Swollen lymph nodes are another one, tingling in the arms or legs, burning pain around the chest, wall area, or the breasts themselves. This is an interesting one, guys. This Raynaud's phenomenon, which is cold or discolored hands and feet. And I know Phyllis had that because she mentioned this to me. And this was another one of those things that her rheumatologist wanted to put together with a, well, big surprise, rheumatologic diagnosis. And that was not the issue with her, but she did have those symptoms. Body odor, muscle twitching, vertigo, fevers, dehydration, frequent urination. Chime in, Phyllis, if you want to share anything more about any of these things. Neck and back pain. I think you were having some of that.
I had back pain and I had knee pain, and within days of surgery, the back pain was gone. The knee pain was gone. And I just always thought it was from all the running I had done.
Yeah. This is incredible, guys. This part of I mean, you can't make this stuff up. This is
I'm not making it up.
Phyllis is a walking miracle thanks to her smarts and not giving up, and her, believing in herself and her symptoms. And then fortunately having a provider which went along for the ride, because Phyllis was driving the truck on this one. She was running the show, and thank goodness she was, because the right things happened.
Yes.
Anyway, a couple more things. Photosensitivity, which just means that, bright lights may bother you. Phyllis and I talked about migraines that can be triggered by this, skin and nail changes.
Yeah, I've had really the ridges in my fingernails, very like paper thin nails, and I've not always had that. So since getting implants.
So that was a newer thing that she had. Skin freckling, pigmentation changes, white spots, dark spots, edema or swelling around the eyes. Some would contribute this to an allergy, or what is sometimes called an allergic shiner. This can be from the breast implants. And that is, once again, from the inflammation that is going on in your body.
And wait till you see, if you're looking at breast implant illness online, you guys, the before and after pictures, when somebody gets an explant, like days or even like 24 hours later, just reducing that inflammation, they look like they've aged backwards 10 years. And I feel the same way. I feel like my skin has changed in just 5 weeks. I'm 5 weeks post-op.
Yeah. And like we mentioned earlier, that immediate, 8-pound weight loss, that was all that inflammation that was quickly resolving, because the source, or the inciting event, if you will, the breast implant, that foreign body, or foreign bodies, I guess, 2 of them were in there and causing these immune symptoms and inflammation, GI and digestive issues, food intolerances, allergies, smell or chemical sensitivities, infections. One that I had heard of, and I don't know if this, I hadn't heard this in you, Phyllis, but other women that I had heard of had frequent like sinus infections. Every flu season they would get sort of sinus infections over and over again. And I think part of this is just from that sort of heightened inflammatory response that was occurring, secondary to having those breast implants there. They just were running more inflammation than typical. And so it was just easier to trigger one of these illnesses. So if you get recurring sinus infections, recurring yeast infections, recurring UTIs, these could be coupled with having breast implants, possibly part of this illness, breast implant illness.
I think that there is a connection between gut dysbiosis too, and this candida yeast overgrowth, because 3.5 years ago, I went down this route of treating candida yeast overgrowth, and I had immediate, I felt so much better. But this is why I'm thinking this rupture is what just threw my body back into this huge response. But yeah, when you look up candida yeast overgrowth, you see chronic sinus infections, UTIs, yeast infections, canker sores. Those were things I had before and had been treating. And so I was in this beautiful detox. And then it was just like my body just said, whoa, what did you just do with a rupture and a surgery, a foot surgery? It was just too much.
Yeah.
And so, yeah.
What do they call it? The straw that broke the camel's back. She was just right at that tipping point, all that inflammation. And Phyllis was like describing this list without even having it in front of her, right? She said a lot of these things: throat clearing, cough, difficulty breathing, choking feeling, the inflammation. You feel like you're dying. headaches, dizziness, migraines, mood swings, emotional instability, anxiety, panic attacks, depression, suicidal thoughts, hyperthyroid, hyperadrenal, fibromyalgia, Lyme's disease, EBV or other viral reactivation type symptoms, dysautonomia. Whew, there's a lot.
There's so much, you guys, but don't give up. Like, this is what I want people to understand is there's hope. If you think, I just thought I was sick, I mean, you have to consider your breast implants.
Yeah, absolutely. I mean, when Phyllis first was kind of trying to place all this in her mind, I remember her telling me that, well, I went through early menopause. Maybe I'm just getting old. And I said, Phyllis, you are not getting old. Come on. You can still go run 10 miles if you want to. Yeah. You are not getting old. That is not it. But I think what was one of the issues in our society nowadays is like legit, people think that you hit 40 and you're like, downhill spiral, circling the drain kind of thing. You get, that's just crap. That is not the way that it is. And with Phyllis, it certainly was not. She's always been healthy, super active, a runner, she could do all these kinds of, high intensity workouts. And then all of a sudden she was having all these symptoms and thank goodness she found out the cause. And with her, it was breast implant illness. So hopefully you guys that are watching got this website, queued up to look at breastimplantillness.com. Just really a cool site. It has everything from the symptoms to the tests you can do. It even has a list of surgeons that you can touch base with, lots of resources there. Pretty cool site. Should we show them a little bit of what it looked like real time when they should we show them a little bit of that?
Absolutely.
So if you're watching on YouTube, guys, we're going to actually put up a couple of photos of what the implants look like. And remember, she found out about this sort of what we would say incidentally on the CT scan that she was getting for a cardiac risk score due to an upcoming surgery, right? She was about to have a foot surgery. And, she was basically telling her doc, do all the things, do all the tests. And even though she was having all these symptoms that were kind of nondescript because they were, fatigue, anxiety, breathing problems, all these things, they weren't really coming together into one sort of coalescing, final diagnosis, if you will. And when she saw, well, actually, this is kind of a little bit of the unfortunate part is she got the report in the mail, like, what happened to the doctor calling his or her patient saying, hey, look, this is what we found? Nobody even called her. Like, holy crap. Thank goodness she read the dang thing to the end, because the first part, remember, Phyllis, it said your cardiac risk score was 0. Yes. Like a lot of people might have just stopped right there. Woohoo! Because that's why the test was done. Yeah. And then, the second or third line, it says there's a right breast implant rupture. Like that wasn't the first diagnosis, right? The first was normal cardiac scan. Yes. So guys, we're going to show you what it looks like to have an inflamed implant. Okay. So those of you looking on YouTube, you can see on the left-hand side, which is her right, because in medicine, we always flip-flop everything. It's how the provider is looking at the patient. So what's on my left, for example, is on her right. So on my left, I see something that I don't see on the right. Yeah. Phyllis, you want to describe this a little bit?
So so when they take out your implant and you have a rupture intracapsularly, so it means it's ruptured inside the capsule. That is very good.
We'll go back and we'll show you. So those are the two full implants and the body's tissue around it, which is the capsule. So that's, in her case, fortunately, although where I'm putting the cursor now, you can see this area is super thin. You can almost see that silicone implant right through this really super thin biofilm or skin tissue here. It was probably like any little thing might have caused this to completely rupture, get outside of the capsule, and probably would have caused even more inflammation. But she was right at sort of this threshold that had ruptured inside of the capsule. And you can certainly see that when you compare what's on the left to what's on the right. Okay, keep going, Phyllis.
Okay, so the doctor said it has to be removed inside the capsule. And so it's an en bloc procedure. with capsulectomy.
So the whole thing, not just the implant. If they say we're just going to take the implant out, like say, whoa, 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 whoa. That's not what I've read, doctor. I've looked at the data and the research, and it shows you should get not only the implant, but the whole capsule in block. That just means all together, all at once, removed. Thank goodness Phyllis knew all that.
Yeah. And so this doctor that I had, he said, if they tell you anything different, you need to run the other way. Run the other way. Because what if they would have cut open that capsule, removed the implants? Where would all of that leaky green stuff have gone that you see there? Would have been all
it would have
inside of me.
spread throughout her entire body. Thank goodness it was removed altogether. And you can certainly see that on the left, there's leakage of the contents. And it's kind of a cloudy, not so awesome looking stuff. To me, as a physician, it looks infected. It looks infectious. Whereas on the one on the right side, or what was her left side, is just, pretty normal, benign looking, silicone implant, right? But certainly the one on the left does not look that way.
No. And so one thing I'm really surprised about is they don't just automatically send this off for cytology or pathology to see what's really in there. And when my doctor described it to me, he said they just find the same like normal bugs. But I'm like,
the normal ones, right?
Bugs.
Whatever those are, the normal ones.
But what's really cool is when I started to do my research, I came across this Dr. Christine Kelly, which I think we might have her information.
Yeah, we're gonna pull up. I'm hoping I can find her.
But she
biofilm.
She is a plastic surgeon in Indiana. She's working with the University of Indiana, and they are removing women's breast implants. They are part of a research study or research program, or that is that they have actually, it's not published yet, but she provided the link that we have for you too, that it's linking biofilm. Yeah, it's linking the capsule, the bacteria found. So it's like staph epi or Staphylococcus epidermis. It's found in the capsule itself, not the implant inside, but the capsule.
So this is inside the body, inside that kind of coating that we were looking at, that fleshy coating that's around the implant itself.
Yeah, it's linking it to triggering some autoimmune disorders. And I'm like, well, there you have it.
Yeah, so this is, I got the website pulled up. This is the doctor she was referring to, Christine Kelly Patterson. She's a plastic surgeon out of Indianapolis, and she's doing a study. In fact, this is sort of the pre-print study with the BMJ, which is hopefully where it will ultimately get published, because that's one of the most well-read medical journals out there. It's like British Medical Journal and the New England Journal of Medicine are like the top two in the world. So I really hope this gets out there in the BMJ, because it would certainly help spread awareness. And you guys can say you heard it here first from Miss Phyllis Anderson and Dr. Thomas Hemingway. We got this out to you before you heard it on, what's that program that comes on in the morning? Good Morning America. I don't know. Hopefully
we could be there
maybe
too.
Maybe we can get on that show and get the awareness up. But what she was saying, which is super interesting, is that with this research that Dr. Christine Kelly Patterson has done, it's looking at this bacteria called Staphylococcus epidermis, which with that tissue, the biofilm and the capsule, it's been shown to activate the immune system, and a specific part of the immune system called the CD4 cells. And this is basically one of the types of helper T cells that, when operating correctly, are activating inflammation to take care of, the badness out there. In this case, it's taking care of that foreign body and that film around the foreign body, of course, being the breast implant, and then the film being the body's inflammatory process, and this bacteria called Staphylococcus epidermis, which is activating the immune system to the degree to where it has all of these symptoms that we looked at earlier, right? Which can be often misdiagnosed as some type of autoimmune disease. And so this is a really cool finding that she and her colleagues have discovered with respect to the biofilm and the tissue, the scar tissue, if you will, the capsule around the implant themselves can lead to the symptoms that we described, right? Chronic fatigue, joint pain, a host of other manifestations often associated with autoimmune illnesses. So really cool stuff. There's science behind this. Even if your doctor says they don't believe in it, they've never heard of it, there is science behind it. It is a real deal. Breast implant illness is a real condition. And we hope someday, real soon, we're going to have it in the ICD-9 diagnostic book. It's going to be hopefully all over the media because, like we mentioned at the outset, millions and millions of people annually have implants placed, and many of them have no idea. I'm sure when Phyllis had hers placed, nobody ever told her anything about this could happen, right? And there's a lot of other things. Phyllis we were talking offline before we got started, and I asked her, what are some of the things that you really want to make sure that all the ladies and all the dudes too, because this is something that will affect you, your partner, your family, and it's good to raise the awareness. What were a couple of those other things, Phyllis, you wanted to relate to any lady considering breast implant surgery?
Gosh, so I feel you ladies, because at the age of 32, after breastfeeding 3 boys, I wasn't real excited about what I was seeing in the mirror. Now I'm married to a wonderful man who loved everything I had before I got breast implants. This was not ever his intention or desire. It was all me. So I made the decision because I said, I just wasn't confident looking in the mirror. I thought, I just want to feel feminine. Like I said, I worked out so much that I had a great body, but I felt like I was missing something. We lived in Palm Springs area where everyone had a pool and everyone had breast implants at the time. And so it was normal. It was very normal to go and have this procedure done. So I just would love, well, what I didn't know was that, like the doctor now, he said every 10 years, you need to have your breast implants replaced. So let's just talk about how much this costs. Depending on where you're at, you could pay probably between $5,000 and $10,000 to get your first set. My first set ruptured about 6 years in. I had to
that was saline, right? Is that right?
And they were saline. So I woke up one morning and I had one boob and not another boob. And I thought there was something really wrong, like an infection or something. And no, I had a ruptured implant. So again, like 3 days later, I was getting surgery and I had the silicone set, which were called gummy bears, and the doctor
still use that name.
He reassured me that if you were to cut this in half, nothing would squeeze out. So there's
famous last words.
No risk of having the silicone spill into your body, where the old silicone did have that risk. And I do know people that had the silicone spill throughout their body. So anyway, but I had to pay another $7,500 to get new implants. And he said, every 10 years, you need to have your implants replaced because the silicone outer shell that Dr. Hemingway talked about, your body's trying to eat that up and get rid of it. So eventually it's going to compromise the silicone outer coating, exposing what's on the inside. And so every 10 years, he said, no mammograms. You should not be getting mammograms because
a lot of ladies don't know this, and a lot of MRI, or I should say ultrasound techs, radiologists, they also don't know this because if you guys recall, what did Phyllis have done just a couple of months before?
In August.
She had her mammogram.
And
tell us for the dudes out there, Phyllis, tell us what the heck is a mammogram and what it's like from a lady's perspective, because dudes need to have a little empathy here. Go for it, Phyllis.
Okay, so a mammogram when you have breast implants is really special. It's not just your entire boob being squished. They do that because they want to see everything, the tissue around the implant. They are looking for integrity. But then they have to then pull all the rest tissue away from the implant and then smush that in between the paddles. And so it is really not a comfortable procedure. And gosh. I was a good girl and I was getting it done every single year. One time did my, I would sign a paper too that said that you do have a risk of having breast implant rupture with mammography. And I looked at my friends because I work in the ER, and my friends work in radiology. And I'm like, is there
How often have you seen this? Have you seen this before? And of course, they would always shake their heads and go, no, it doesn't happen.
Yeah, it's fine. So I did my due diligence and had my mammogram and never got an MRI. And now my doctor, I remember him telling me when I had this last set put in 12 years ago, he said, you need an MRI. When was the last time you had an MRI? I'm like, never. And all I could think was, this is going to cost me a bundle because your insurance won't pay for that, by the way. This is all money out of your pocket to get an MRI. Well, I find out that it's really not that expensive, but it's about $250.
That's now Phyllis mentioned this, that if it's paid for out of pocket,
Yes.
without insurance, all of that. And this actually goes, I discovered this myself sort of accidentally a couple of weeks ago. I broke my arm and we were sort of between insurances and so on. And so I was kind of hesitant to get an x-ray. And I didn't barter with them, but I said, look, I don't have health insurance. I know that you can give me a cheaper price if I pay in cash. And they did. I just got a simple x-ray. That was $50. That's it. Phyllis and I, for decades have worked in the ER. And if we order an x-ray, it's like $500,
Yeah.
And this MRI scan, she said she got for $250. Well, if you get it done as a part of, like an urgent care or ER visit, it's going to be like a couple $1,000. So if you really need to get something done and your insurance won't cover it, tell them you don't have insurance, you will pay in cash, and they will always give you a discount. Just like I got my x-ray $50. She got this pretty dang fancy test for $250. I almost didn't believe her. I said, no way, that's like $2,000.
Yeah.
But it is a cost that your doctor never told you about.
Yeah.
Right? Every 10 years replace them. So that's another 10 grand plus $250 every couple of years, 3 to 5 years. Don't get the mammography the mammogram that you think you're supposed to get. Because once you have implants, like not only is it super duper duper routine and uncomfortable, but it may cause rupture. And, I'm not saying it did, but when you look at the timing of it, it wouldn't be surprising if that could have contributed to the rupture that Phyllis experienced, having that mammogram a couple of months prior.
Yeah. And your insurance. So here's what else was wonderful about knowing that I had a rupture prior to my surgery was I asked the plastic surgeon's office, like, hey, my insurance, I looked up online, I found myinsurancecompany.com, read in there, like, are ruptured implants covered? And lo and behold, they are. So when I went in, I was kind of already armed with, I have proof that I have a rupture. My insurance says they'll pay for it. Can you please contact them? So again, guys, I had to advocate for all of this. And so they said, we'll call them. So they did. And a few days later, I got a phone call from my insurance saying something about being out of network. Can you find another doctor? I said, guys, the other thing too about finding
you want to get somebody that knows and has done many, many, many of these, because like you saw in the picture, not only do you got to pull out the silicone part, which wouldn't be super hard, but you got to remove that whole capsule. And that takes expertise, experience, and having done this a bunch of times. So you just don't want any old person to do this. Right. You want the best.
You want the best. And so they said, this is probably, or can you find somebody closer? And I said, the next closest would actually be further away. So they said, okay, no problem. And anyway, so I downloaded a little piece of paper, attached my receipt because I had to pay cash up front for this procedure. Some people, it just depends on your insurance. So find your insurance, figure that out. But I sent it in to be reimbursed. And our HSA plan actually paid for that. So we were able to use our HSA plan to pay cash, pay for it right away. Now we're just waiting on reimbursement.
So in Phyllis's case, because hers had actually ruptured, and there was CT evidence of that. Remember, she had that scan done for a cardiac score. The insurance didn't balk at all at covering it. Now, here's what I would like to insert here, guys, is that and gals, of course, is that if you don't have a rupture, that does not mean that your insurance will not pay for it. There are many, many, many diagnostic reasons, symptoms that your doctor could basically describe to the insurance company, like severe pain, burning of the chest. There's a whole list of probably 10 or more symptoms that would get the insurance company to cover the explant procedure, even though they may not be ruptured. So don't be like worried that, oh my gosh, the scan shows mine aren't ruptured, but I have all of these symptoms, that whole list of symptoms that Phyllis and I went over a few minutes ago, and you have a half a dozen of those or more. Don't worry. You can, if you can get your doctor to describe those symptoms as severe as you are having them, the insurance company will cover that. But it's a little bit of, you have to kind of work with your doctor, make sure they know all of your symptoms and they can describe them well, because, if you can get your insurance to pay for it, obviously that's the way you're going to want to go. And it certainly can be done even without rupture. So I just want to make sure you guys and gals knew that part. The rupture part makes it kind of a slam dunk, but many of the cases of breast implant illness will be without rupture. And that is because, as Phyllis and I mentioned earlier, all breast implants, whether they be filled with silicone or saline, all have the sort of external portion in silicone. So your body is being exposed to that silicone, which creates then the biofilm and probably some involvement of that staph epi bacteria, activating the immune system that we talked about earlier on, that contributes to this overwhelming inflammation that causes all those sort of rheumatologic symptoms that we talked about. Anything else that you really wanted to get out there, Phyllis? We still got a couple more minutes.
Yeah, I think it's just, I guess women too, they think I cannot possibly get these implants out. I've had women say, I feel like I'm just going to be mutilated or not happy with the results. There are other options. So I had a lift with mine, and I have to say, I'm really excited about what I see. My husband's like pleasantly surprised. Scars will fade, and they give you all the right things to put on your scars. I would not use anything silicone based because that's what we're trying to get away from. So I have some beautiful options for that. It was like a vitamin C oil and some other great serums that I use for my skin already. And then, and so also you can get a fat transfer where
autologous, it's called an autologous transplant of your adipose tissue from another place that maybe you want it removed from. You guys ever heard of like liposuction or something like that? So it's kind of like that. You take a little bit of fat out of your butt or your hip or wherever you want to get rid of it. And then you can do basically a transplant. They call it autologous because it's your own tissue. They take your own tissue out of one place and put it in your boobs, in your breast tissue. Yeah. So that's kind of a cool thing. They didn't do that when I was in medical school.
Yeah, I have friends that have had it done and they love it. Everything, I just say every surgery, every procedure comes with risks. So, just do your homework, do your research, and don't go into this blindly. Find a great doctor that believes you, that will remove every piece of that capsule, because if one little piece is left behind, your body's going to still continue to react to that as if the entire capsule is there.
And so I like what she said, like, make sure your doctor or provider is listening to you. Mm-hmm. And if you can't get them to listen to you and they're not giving you the time of day and you're describing your symptoms and saying, hey, doc, I've been talking with a lot of friends and other folks that I've met that have these same symptoms, and they've ended up with this breast implant illness, and they basically got better when their breast implants were removed. What do you think about that? And if they just kind of do the eye roll and they don't want to look into it at all, I mean, you might need to find a new provider. And that goes with this issue and many others. And sadly, I think because physicians in general are so pressured to do a lot of things in a little amount of time, a lot of docs don't take the time to listen to you. So make sure your doctor listens to you. And like Phyllis did, be your own best advocate, because although I'm sure at heart, they really want to be that advocate for you, for whatever reason, they're too time constrained or whatever it is, it may not work out that way. So you guys and gals, be your own best advocate. And Phyllis is just the sort of poster child of how this all came together perfectly. And she was her own best advocate, and she didn't take no for an answer. But look, she's as pleasant and sweet as could be. And her doctor, thank goodness, went along for the ride because
Yeah.
she was driving that bus.
I'm so grateful, just so grateful that I feel so good. I don't even think I ever talked about, like, my face is thinner. I'm wearing my wedding rings, lost the weight. I had a follow up with my rheumatologist who said, we're not going to put you on that prednisone or the methotrexate anymore
Thank goodness,
because
please.
you're not having symptoms. I'm like, thank you. And I had originally
Oh.
said, I'm not doing that until these implants come out, and I'll deal with the pain and how I was feeling. But I just knew I needed to see the difference of getting the explant first.
And that I love that Phyllis just mentioned that, because one thing I personally find a little bit annoying with a lot of providers, physicians, other specialists out there is they unfortunately don't always look at the big picture. So Phyllis asked me about these medicines, hey, this rheumatologist wants to give me whatever it was, methotrexate. I don't recall which ones you talked about, but several different ones. They have these big gun sort of immunosuppressant medicines. You guys see the commercials every day, right? It's like, if you have this eczema rash, you could take this infusion once a month and it'd get rid of it. But by the way, this could cause overwhelming sepsis and death too as a side effect. But I would be willing to bet, had her rheumatologist put her on these big gun steroid and or other immunosuppressants, a lot of her symptoms probably would have gotten better. But the problem would be the inciting event or factor, the breast implants themselves causing this inflammatory problem, would still be there. And so what would that mean? Would she have to be on these immunosuppressant medicines for the rest of her life? Like, go to the root of the problem. And Phyllis did exactly that. And when she tackled the root of her problem, her symptoms went away. And for me, it was, almost unbelievable how quickly she described. You guys heard it just with the breathing. It was literally within hours, weight loss within a couple of days, all of these problems with her swelling, her ring not fitting her. She's only a couple of weeks out here, guys, and she is like completely different person. She's back to the same Phyllis she was 20 years ago, with the smile and the glowing and the energetic, ness that she's already, I think I made up a word, energeticness, the energy that she's always,
it works.
But it works. Like, this is having a provider that will work with you, that will listen to you, that will go to the root of the problem and not just treat a symptom. That is gold. And that's, fortunately, in Phyllis's case, this all worked out. And we just wanted to share this with you guys so that you could be your own best advocate, or your sisters or girlfriends or mothers or whoever it is that may have this illness because they have lots of inflammation and they have also had breast implants. It could certainly be a possibility, because it is, fortunately, starting to slowly come to light. People are, becoming aware of it. Whereas, I had never even heard of this a few years ago, like never. And now thinking back at the thousands of patients I've treated, and many women with a lot of these symptoms that were often given diagnoses of some kind of rheumatologic condition, even though it never ran in their family, they didn't have any reason to get a rheumatologic condition. I think back and I go, gosh, I wonder if that could have been breast implant illness. So anyway, any other parting words, Phyllis, that you just want to share with all these lovely people out there?
Yeah, check social media too, because on Facebook, there's a breast implant illness research group. I would kind of go to the bigger ones that have thousands of people. It's actually somewhat heartbreaking to see so many women like so desperate, but also very excited about getting their breast implants out. But then there's also like a group of women who just say, I can't afford it. I just say, you know what? I have a friend that did a GoFundMe page and she got her breast implants, the explant, paid for. So just know that, where there's a will, there's a way. Get these things out. If you're having these symptoms, like, don't wait, don't hesitate, and check out these groups, because that will just kind of seal the deal for you, and you'll not feel crazy, because you're not.
You absolutely are not crazy, and you deserve to be listened to. And if it's not your current provider, like I said, you might need to find a new one, and reach out to people like Phyllis. She can, certainly give you guys a lot of super helpful information. We've shared a couple of websites here as well. Tell us, Phyllis, just how our listeners can reach out to you personally, how to find you, how to follow you. Tell us that stuff, and then we'll part.
Awesome. Thank you. So I'm on Instagram at wanderlustphil, PHYL. Definitely DM me. I'm on Facebook at Phyllis Anderson, SON. And I've helped so many women. And then there's a detox that has to happen afterwards. Our body is a beautiful machine, but there are some things that you can do to support the detox that's going to occur afterwards. And I've helped many women just walk through, like, this is normal. You're going to expect this. Like, there's some things that happen that are normal. And so I think it is just having that support is so key. So please reach out to me. I would love to help you with the detox. Just love to support you. Just want to get the word out. And then, again, just anything I can do.
Awesome. Wow. And guys, I will put all of that in the show notes on the Modern Medicine Movement podcast. We'll give you Phyllis's contact information there that she shared on Insta, on Facebook, and you can reach out to her. She is such an amazing woman. And I am so grateful that she got down to the bottom of this mystery inflammatory condition that her rheumatologist wanted to hit her with the big gun steroids and immunosuppressants, and so grateful that she did not have to go down that route, because she got down to the root of her condition, which happened to be breast implant illness. And it is a real thing. There are many out there who may be suffering or may know somebody who may be suffering. So I'd encourage you to learn more about it. Please follow Phyllis. Please follow me. Reach out to either one of us, especially Phyllis, because she's got all the info, and she's also an amazing support, and she's just kind and loving. So thank you guys for listening. Thank you for taking time out of your busy days for listening to the Modern Medicine Movement podcast. We're so grateful that you took the time out. We're so just glad to get the word out, because I don't think this has been shared about enough, and maybe many of you haven't even heard about it. I know there's lots of physicians out there that don't even know what this is. So share the word. Please tag your family and friends that you think need to hear this, and feel free to tag us and reach out to us. We'd be happy to talk further with you. So thanks again, guys. Really appreciate you. And hope you enjoyed the YouTube version, because we don't do this all the time. But hey, I had Phyllis right here in my own home, in my very humble recording studio that doubles as a spare bedroom. And we got Phyllis and soon her husband visiting. We're so pumped to have him here visiting us, and it's just amazing people. And I'm so grateful that she's such an advocate and a proponent of getting the word out on breast implant illness. So thanks again, Phyllis Anderson, for joining us today. We just love you. Thank you so much.